team that I work with here is very special. Most of them have been here quite a while. Some have only been here just recently, but everybody kind of helps each other. Although somebody is assigned a particular case, everybody pulls together when there's a need. So if somebody's sick, we all kind of rotate around. So it's not beyond somebody who may be a life care planner who's a nurse going out on a case management appointment. And that is important because it validates what that person's doing in research. If they don't only focus on the research part and never get to meet the patients, then they really don't understand what we're doing. So that collaboration and working together as a team is a real essential.
Our strengths are we're hands-on. We don't sit on the telephone and talk to you. We meet our patient where they are. And if you need a hug, we give you that hug. If you need a cheerleader, I'm the cheerleader. I get involved with the family. I support the family through difficult times. I navigate the whole healthcare system for you. Wherever you are, that's where I am.
I think what separates us from a lot of the other companies that are providing the same type services that we do is the variety of services that we provide people. RCC does life care planning, we do case management, home assessments, we do special work with people with special needs trust. There is so much that we can offer. We're also involved with community events such as the Brain Injury Association. We attend events such as Victories of Spirit. We also do walks for the San Diego Brain Injury Foundation. So we're very involved with the community.
Most people provide episodic services, and we provide the continuum. We're a rehab-based company, so we look at not only what do you need now, but where are we working.
I think there's a unique respect here for one another, and that no one's right, and we're all working for the patient. And I think that's really important.
Since I've been here 17 years, we have grown considerably. The need is still there. And I think that the community of health professionals as well as families are seeing the benefit of having a company like this to help them navigate through the difficult healthcare system and to advocate for their patients, their children, elderly population, and to help identify resources.
A number of us have been in this community for quite a few years. We have relationships with physicians, and a lot of people have problems getting physicians to be their experts or be their treaters. And we don't have that problem because they'll just hear, oh, it's one of RCC's people, or it's Doreen or Renee or Diane or all of us. And so what they kind of realize is that we're going to be there. And so one of the physicians said, when I told her today we were bringing a new patient in from Bakersfield, she said, I'll put a caveat on it. I'll treat the patient if you guys will be the case managers. Otherwise, I'm not going to be the treater. So that's kind of a shared camaraderie that most people don't have. They don't have that kind of relationships.
My name is Diego Medina, and I've been with RCC for almost 10 years. I think it's a good relationship because RCC is, like I said, a family, and they listen to my needs. And most importantly, like I mentioned, they're always there, willing to help me out in anything that I need, and I listen to them and they listen to me.
So I think case management, the strengths are that we do it for both injured workers, and oftentimes we do it after the injured workers have settled. And so we do it long term and help them and help the family. And then we do case management for children and help them along that continuum and help the families. We kind of look at that whole continuum of case management. So you have the workers' comp, so a person who gets injured on the site and helping them go from the acute care hospital to the rehab back into the community, and then the case management for adults or children.
It's been a very collaborative and good, nice working relationship. Heidi has always been so kind. Each time Social Security calls me to come in and reprove that I'm still disabled, she's always got my back and comes with us to work through the different heights of the hoops that they made me jump through.
I am involved with case management quite a bit. I am the case coordinator, so the case manager and the case coordinator work side by side. We take a case and we team together in providing case management and coordination of services to our clients.
As a case manager, I go out and assess patients. I participate in treatment plans. I coordinate care. I identify appropriate resources to help either an injured worker or a disabled child or adult to achieve the most outcome from their injury or illness.
In this community, RCC is really a one of a kind. I don't know of any other group or agency or organization that does what they do. They've got amazing nurses, they've got great staff, they have relationships with payers and insurance companies, and they know how to make things happen. So I think they're a very special and unique resource for San Diego.
Our role is to advocate, to assist, to provide education, training, resources, and we're going to keep doing that. I think in addition, we are really working on home assessments. So there are assessments where we'll receive a call from a bank, a trustee, or a fiduciary, or an attorney, or even a medical professional who knows of a client that has been disabled for many years, and they're not sure if they're ready to make a transition from their home to a facility. So they're asking our recommendation, our opinion.
Our clients, for the most part, are professional fiduciaries or corporate trustees like First American, Wells Fargo, that administer the special needs trusts. So our clients have expertise in the management of money, but they don't have expertise in the medical issues and care issues for these individuals. So we encourage our professional trustees to get expert help in managing the day-to-day lives of the disabled beneficiaries, and that's where RCC comes in.
As a rehab nurse, I've always been a case manager, advocating and collaborating. So advocating for their rights and their needs and collaborating with the physician.
Doreen is also a great resource in terms of her clinical knowledge, and she oftentimes thinks of things that a patient might need that I have not thought of. So she's a great part of the treatment routine.
I first heard about RCC just when they came and met me in my room a few days after the accident. Through my doctor and everything, I heard that Doreen was a great case manager. She figured out my personality after a while, and she knew that, what to ask me, or she just knew what I would think, what she thought I would say, and she wouldn't throw stuff at me that she knew I wouldn't want or wouldn't want to do. So once we got on the same page, it was super smooth.
The life care plan is really an extension of the nursing care plan. In the hospital, we do care plans that identify what does the patient need for this diagnosis and how can we best help the person so that they can get better and move back home into the community. But a life care plan looks at the person from the moment of injury or the catastrophic, either injury or life event. And then we help them identify all the services and the physicians and equipment and supplies that they need and help them over their life.
Anything medical I needed, from like scheduling doctor appointments or any medical supplies, going to all the appointments with me, just making sure you're comfortable with the new transition of, like, obviously it's like a life-changing thing, so they just help ease the process of like getting you to being independent and just making your life as easy as possible through a difficult time.
You know, the goal is not to create somebody that's dependent upon us, but the goal is to find out what resources they have so they can be independent and then use us to access services, whatever that happens to be. So the success is them assuming that role.
One of what I find real important here that I've told Doreen over and over is it doesn't matter if we're on the plaintiff or on the defense side. We truly advocate for our patients. We want the best for them.
In dealing with the difficult patient situations that we can face with catastrophically injured individuals, you have to have a certain personality, one that's very caring, but one that's also pretty tough. And you have to endure some pretty difficult times standing there next to your patients and seeing them through probably the worst times that they've ever had in their lives and getting them through that difficulty. So it takes a lot of, just a lot of dedication, and that's the RCC team really possesses that, and that's what makes it work well.
A life care plan is a dynamic process because we're all dynamic. We change, we grow older, we have new diseases, and so we need to flex that life care plan as we change. Our environment changes, our family supports change, and so we need to be able to make those changes.
The one thing I have always valued is I get to see the life care plan as it's developing. I see it in its draft forms as it's evolving over time. A life care plan, from my experience, is a work in progress. It's developing, it's dynamic, it's not something that's set in concrete and that's it. Once it's done, you walk away from it.
RCC is very dependable. So if I call and I need to speak to someone, it's not a gap in time, where I'm waiting and wondering why nobody's gotten back to me. Same thing goes for the patient. When I talk to my clients, they're so very appreciative of what RCC is doing for them and helping them through a tough time. So that's what makes the relationship so special. When I hear good things about RCC from my clients, that means the world to me, because what they do is not only a reflection of who they are, but also what we're all about.
RCC allows me to offer everything I've got to improve somebody's situation. Again, I don't know how else to emphasize the fact that you're working with other people as a team. You're not working just as a single entity with no knowledge of anything else that's going on. If I have information that I think is essential, I can share it. I know that somebody else will take it and understand it and appreciate it.
We always look at the glass as half full rather than half empty, and we always look at the potential. So we want to make sure that the person just doesn't live in a home going to therapy for the rest of their lives. What are they doing? How are they contributing to society? And how can we help them feel like they have something to do, something to look forward to, and someone to do it for?